Opzelura Topical Cream is used to treat a skin condition called eczema, atopic dermatitis, in people who should not use or have not responded to other eczema medications. Eczema is an allergic type condition that causes red, irritated, and itchy skin. Active ingredient Ruxolitinib. This drug works by weakening the skin defense immune system, thereby decreasing the allergic reaction and relieving the eczema. Ruxolitinib belongs to a class of drugs known as kinase inhibitors. This medication should not be used by anyone who has a weakened immune system, for example, following an organ transplant. Indications and usage. Opzelura is a prescription medicine used on the skin, topical, for short-term and not continuous chronic treatment of mild to moderate eczema, atopic dermatitis, in non-immunocompromised adults and children 12 years of age and older, whose disease is not well controlled with topical prescription therapies or when these therapies are not recommended. The treatment of a type of vitiligo called non-segmental vitiligo in adults and children 12 years of age and older. How should I use Opzelura? Opzelura is for use on the skin only. Do not use Opzelura in your eyes, mouth, or vagina. Use Opzelura cream exactly as your healthcare provider tells you. Apply a thin layer of Opzelura 2 times a day to affected areas. Don't use more than one 60-gram tube each week or more than one 100-gram tube every 2 weeks. Ask your healthcare provider if you have questions. If you are using Opzelura for atopic dermatitis, stop treatment when your signs and symptoms of atopic dermatitis such as itching, rash, and redness go away, or as directed by your healthcare provider. Tell your healthcare provider if your symptoms do not improve within 8 weeks of treatment. If you are using Opzelura for non-segmental vitiligo, tell your healthcare provider if your treated skin does not improve within 24 weeks of treatment. Wash your hands after applying the cream, unless hands are being treated. If someone else applies the cream, they should wash their hands after application. Dosing information. Usual adult dose for atopic dermatitis. Apply thin layer twice daily to affected areas of up to 20% body surface area. Don't use more than one 60-gram tube per week or one 100-gram tube per 2 weeks. For topical use only, not for ophthalmic, oral, or intravaginal use. Use topical short-term and non-continuous chronic treatment of mild to moderate atopic dermatitis in non-immunocompromised patients 12 years of age and older, whose disease is not adequately controlled with topical prescription therapies or when these therapies are not advisable. Usual adult dose for non-segmental vitiligo. Apply thin layer twice daily to affected areas of up to 10% body surface area. Don't use more than one 60-gram tube per week or one 100-gram tube per 2 weeks. For topical use only, not for ophthalmic, oral, or intravaginal use. Use the topical treatment of non-segmental vitiligo in adults and pediatric patients 12 years of age and older. Opzelura side effects may cause serious side effects including low blood cell counts, cholesterol increases. The most common side effects in people treated for atopic dermatitis include common cold, nasopharyngitis, diarrhea, bronchitis, ear infection, increase in a type of white blood cell eosinophil count, hives, inflamed hair pores, folliculitis, swelling of the tonsils, tonsillitis, runny nose, rhinorrhea,